Hello, everyone.
Hi, Catherine.
Hi, Catherine.
Hi, Magda. Hi, Tita.
Hello.
Hi.
Hi, everyone.
Okay, welcome everyone to this webinar on impact policy organized by the African Population and Health Research Center. We are very sorry we are starting almost 20 minutes late for some technical issues that we experienced, but we deeply appreciate your patience for stay with us to walk through this journey with us. I think our presenters of the day are all here, and maybe most of them are putting on their cameras. So if Alfonso, if you can also just put on your camera just to say hi to the audience before we start, that would be great. Thank you. Okay, maybe he's struggling with some technical with his computer as well. So welcome once again to this webinar, as I mentioned, organized by the African Population and Health Research Center. The African Population and Health Research Center is an evidence policy African think tank, African-led research center with headquarters in Nairobi here in Kenya. We have a West African office in Dakar, Senegal. We are very intentional in generating high-quality evidence and translating this evidence into policy. But as we all know, there is an issue. Everybody wants to do impactful research, and it is not only a moral imperative, but an ethical imperative for the research that is being carried out to be impactful. But we have a standing question that actually stands out. What is impact? How do we conceptualize impact? And how do we scale impact? And that's actually why we are here today. As a research center that has been operating in the continent for over 20 years now, the African Population and Health Research Center has had some experience in coming up with some impactful research that has influenced policy within the African and global ecosystem. So we're going to have the opportunity to reflect on our experiences, what we have learned, and we have the opportunity to have our executive director who is here, who is going to be starting, who has been around for quite a while, and she's actually going to give us some perspective on how this has actually been done. For our audience, please feel free to introduce yourself in the chat. We are going to start with the presentations, and along the line, we're going to give some room for some questions and answers. Considering the fact that we are actually running against time, I'm going to move straight forward to presenting our first speaker of the day. Our first speaker of the day is the Executive Director of the African Population and Health Research Center, Dr. Catherine Chungi. Dr. Catherine has a background in medicine and epidemiology, but increasingly over the years, her work has tended to be focused mainly on global health leadership, thought leadership in global health. And if you want a center that has actually been able at an organizational level to mainstream gender equality, you should come to the African Population and Health Research Center under the leadership of Dr. Catherine Chungi. So I will now let the floor for Dr. Catherine for her welcome remarks and to walk us through the APHRC's experience in generating evidence and translating evidence into policy, what we think when it comes to impact, and what we have as a vision as a center when it comes to impact. So welcome, Dr. Catherine. Thank you.
Thanks a lot, Lucio. I think my mic is working. And good to see you, Peter and Robert and Magda. And welcome to the audience. It's a Monday evening, early evening here, and I believe it's morning in some parts of the world. But it's good to see a large audience. And I've been given a very difficult task, and that's to speak about our experience in 15 minutes. And so you'll bear with me as I try to compress, almost 20 years of experience in 15 minutes, but also happy to clarify a lot of things as we go along. So I titled my talk, Research to Impact with a question mark. And the reason why 15 minutes perhaps is not enough is because this is something that is a long-standing issue that as an institution we've been grappling with. We are now 23 years old, and since inception, it's something that we've been grappling with, how to achieve impact, but fundamentally, what is impact? a research center or a research and policy center. But in spite of everything, I think it's possible to say that research to impact is impossible in some circumstances, but also that it's possible to have some kind of impact. And my task is to take you through the next 15 minutes or less, hopefully, to try to see how that is possible. And so my key message is around two things that are research to impact or research to policy impact. There are three things that are required. One is that it requires resources, of course, people, time, money. And then I think it requires institutions to do that. Maybe obviously, but I think the role of institutions cannot be overemphasized. And of course, speaking from the perspective of a research and policy institution, then clearly, of course, that we have a role to play in this. And then the last thing I'll say is about frameworks. And these are frameworks both for research to policy or research to impact, but then also frameworks that make it possible in terms of the infrastructure, in terms of the people themselves, and in terms of the players in this research to policy value chain. And then I'll just highlight a few examples about what we've been able to achieve as an organization. So I think there's no doubt, maybe I'm preaching to the choir in this, but the fact that as a community, we have a translation problem. And there are two graphics on this slide. One is a paper which was done, I think, almost 16 years ago, that shows that it takes on average 17 years from doing research to translating it into some kind of action. That's an average. And I would imagine that this average varies from region to region. If you're in a part of the world which has a lot of research and which has good frameworks that facilitates translation of evidence into action, then of course the time may be shorter. But generally speaking, the global average is 17 years. And there's an updated version of this paper which says it's actually not 17. I think they came up with 14. That was about 20 years ago. So 17, 14, okay, huge difference. When there are problems in the world to solve, maybe perhaps there's not so much of a difference between 14 years and 17 years. And on the right of my slide is another statistic from the World Health Organization, which shows that only a fraction of the applied health research that is done is translated into any kind of action, whether it's a policy, whether it's a product, or whether it's a technology. So there's no doubt that we have a translation gap. Now, of course, speaking from an African institutional perspective, part of the reason is we don't have nearly enough African researchers, we don't have nearly enough African experts, we don't have the people that are on the ground and are capacitated sufficiently, but also have the profile and the recognition that would facilitate translation. And then, of course, looking at an African institution or an African ecosystem from a global perspective, that a lot of partners on the ground perhaps are not trusted as individuals or as institutions, and perhaps they don't fit in the global frame of what a trusted partner is. But then fundamentally, I think we have a problem of translation champions. So if you don't have near enough researchers, then of course, if some of those are going to be translation champions, then the problem is sort of aggravated. And of course, most of these statistics is maybe familiar with the audience, that we don't invest enough as a continent in research and development. But then maybe as a result of the little investment in research and development, but also for many other reasons, we don't have enough health researchers. And that's a graphic which shows the number of health researchers per million inhabitants, where the African average is about 20, compared to European average of 244. 12 times more researchers in Europe per million inhabitants compared to the African continent. So if you take this 20 per million, and then you're trying to find who of those potentially could be translation champions, then of course you can see why that would be a problem. And then there's a question of time. Of course, time is not elastic. We have 8 hours in a day. Hopefully, sometimes we stretch those to 12 or 14, but time is not infinite. But I think there's another dimension of time, which is about priorities, and priorities are shaped by rewards. And one of the things that I think I want to emphasize is that within the research to policy ecosystem, it is what we give priority to, what is rewarded is what gets done. And there are times when I feel like if we rewarded something different, if we rewarded the policy to impact maybe actions, researchers would probably shift but now we reward different things. And therefore, if you have limited time, then of course you do the things that will give you the maximum rewards, whether those rewards are new grants, whether they are recognition, or whether there's promotion if you're in an academic institution. And that's maybe part of the problem, that if you want to solve this problem, we need to reward different things. And we need to reward the investment that goes into research to impact. So that's the first thing: people, time, money. Now, the second thing I want to talk about is institutions. And in this case, I'll sort of flip to the other side about our experience as the African Population and Health Research Center. That since inception, APHRC was set up as that institution that will do research and policy. So it was set up that we do good science, but then we have to constantly ask ourselves the why question. Why do we do research? Do we do it for ourselves? Do we do it to, throw knowledge into a universe or a void that hopefully we can fill with, smart knowledge? Or do we do it with some purpose to society that goes beyond knowledge generation? So our vision and mission have evolved over time, but they've evolved around the same thing, which is how can you use research, how can you use research products to have a direct impact on people's lives? And so with time, we question whether that vision is too lofty, but we think not, that it's actually not that lofty. And we've tried to create a very simple theory of change about how potentially research could transform lives. Of course, it's done, but doing research on itself does not transform lives. Research could be transformed if the evidence from the research is used. And there are two keywords there. One is evidence and the other one is use. So it's not sufficient also to translate research products into evidence and expect that on their own, that will transform lives. So I think for purpose of this presentation, the first two parts are perhaps the most important. But as an institution, if you think about quantitative impact, then the research should be done and evidence should be used by more and more people. And therefore, we invest a lot in capacity strengthening for both institutions and individuals to see that the impact that we could potentially have, if we get it right in terms of evidence use, is quantitative and is amplified. And then the last part, which is perhaps very important, that research can transform lives if researchers use the expertise that they gather from doing that research to support decisions that directly or indirectly impact lives. And that's in a way something also which perhaps is a lesson that we've learned, that in many instances, decision makers or policymakers do not necessarily want evidence all the time when they're making decisions. Sometimes they want expertise to support them make certain decisions. And so we have to ask ourselves, maybe it's the conceptualization. What is policy impact? Is policy impact when we provide evidence, or is policy impact when a Minister of Health, a Minister of Education gets guidance into making some decision that could potentially have a positive impact on lives? So we look at decision-making again, not necessarily policy, and the decisions that could impact lives range from policies, whether it is new policies, changing existing policies, improving existing policies, but operationalization of those policies, which many times actually is the gap in the decision-making chain. But then also we see that lives can be impacted by evidence if evidence is used in the design of new programs, the implementation of new programs, and also the improvement of existing programs. And you can go all the way to service delivery, to budget allocation, but also to individual and community behavior. So when it comes to conceptualization, we conceptualize change or impact from the individual all the way up to the national, subnational, supranational, regional, and maybe perhaps a global level. And as a result, we work with a broad range of partners, both state and non-state actors. And as an institution, we intervene at multiple levels, ranging from the continental level all the way down to working with grassroots organizations operating at the local level. So I think the role of institutions is that in their DNA, the strategic framework of those institutions should center research to policy impact. Because if it's not centered in the strategic framework, whether it's in the vision or mission, then it's very difficult to have this work, which takes a lot of time and resources, to have it as an add-on, as something that people do as a by the way. So I think one of the things why perhaps we've been successful is that our strategic framework already embraces this approach, that research has to have value to society beyond, the production of knowledge. And then, of course, beyond that, the strategies that we put in place, our identity as an institution, we're very careful to say that we're a research and policy organization, and not just say we're a research organization. But also we've set up reward systems whereby academics or researchers in APHRC are rewarded for policy impact or for policy outreach, and not just for publishing or getting academic accolades. So I'll talk about frameworks. And again, we've tried different frameworks. I'll just talk about the framework that we are trying to adopt as an institution, and that's the system thinking approach. And that's also, after many years, a realization that we try to do a lot of things, the existing frameworks, and we find that somehow we are not quite getting the kind of impact that we want. And so we're in a learning process of seeing how do you operationalize a system thinking framework when it comes to the kind of impact that we want to achieve. And I'll just give a quick illustration about typically what we've been doing for many years and why we're trying to do things differently. So we're using the APHRC model for system thinking. And this is an example that in this country, every year, at a certain time of the year, when national examinations are happening, we get bombarded with stories about how girls that are sitting these national exams are giving birth in hospital. And then, so those are the events. That's our public conscience about the problem perhaps of teenage pregnancy or some other bigger problem, because when teenagers get pregnant, you have to ask about the legal, about the moral, about other issues of why a teenager is pregnant and giving birth when they're supposed to be sitting a national exam. So those are events. But under those events, there are patterns. As researchers, we obsess about patterns. So we publish papers and we publish reports about adolescent fertility rates. So those are things, they are trends, and we are looking at them and it's like, okay, the trends are going down, I think, from this graph. And so we do a lot of that and we produce reports about adolescent fertility rates. And then there are structures of the system. Why are we seeing these patterns? Why are we seeing the events? And the structures largely have to do with policies, laws, structures, and many other things. And so what I'm showing here as are examples of laws and policies that exist in Kenya that perhaps could have an impact on the patterns of behavior that we see or the events that we see. But what we've not been looking at is the bigger part of the iceberg, which is the mental models. What assumptions, beliefs, and values do people hold about the system? Because ultimately, the policies that we have, the systems that we have, the structures are a function of society. And so even our policymakers, when they make decisions, these are shaped by mental models. And so this is one way where you're trying to say, perhaps should we focus a bit more on mental models rather than trying to shift the structure, where in actual fact, a structure is a function of a much bigger issue in society, which is the mental models. So this is just an illustration of the kind of things that we're doing when it comes to frameworks for research to policy. Now, the last part, as I said, this is a framework that could help us perhaps be more impactful. We have other frameworks that we try and have helped us achieve impact to a certain extent, but we're trying to get better and perhaps to see whether we can have more impact. But I think maybe one of the biggest problems that we have is that we don't always have research to impact frameworks within two constituencies in this equation, which is extremely busy researchers and extremely busy decision makers. And so really what perhaps could work is having a way in which busy researchers are connected with decision makers in a way that is meaningful and sustainable and long-term, so that perhaps the continuous engagement with each other, understanding each other's problems, understanding each other's issues, understanding each other's priorities, then perhaps if you're able to crack this bridge, to build these bridges that are not just project-based bridges, but are bridges for the future, bridges that last for long, then perhaps actually a lot of the other issues would be secondary. So I think this is one way. Again, it's a different way of looking at frameworks, but I think something which is important. So the last part of my talk is about what is possible. And these are just illustrations of work that started from a researcher or researchers working to understand and generate knowledge, and then saying, so what? And then investing a lot of time and effort in forming partnerships with decision makers, and then having something that you could say is tangible in terms of impact, something that directly impacts lives. Of course, quantitatively, these may not be thousands and millions of lives, but I think it's a beginning point. And I think something that shows that it's actually possible to, as an institution, as individuals, to do great science, publish it in great journals, but also create time and effort for change. So the first graphic is about a human milk bank that we supported to be established some years back. And surprisingly, even after the research project ended, the milk bank is still running, because the engagement with stakeholders and partners, the engagement with the local government, the Nairobi City County, has ensured that even after the research has ended and the researchers have packed up and left, even after the papers have been written, this is actually something which is still operational. And maybe that's the question of how do we make change sustainable? And then the second is work in progress, but I think something which perhaps could also be transformative to some extent. It started from an understanding of risk factors for non-communicable diseases and moved to understanding of the food system, and might just perhaps become the first, there's some kind of action around front of pack labeling of foods, processed foods, so that people, when they go out shopping in the supermarket, they can make an informed choice about whether whatever they are buying is good for them or not. And perhaps with time, this might shape the behavior of the manufacturers so that they reduce the harmful content in food. But this is a process that started many years back in generating evidence about non-communicable disease and food systems. And then this is a screenshot from the website of one of the largest NGOs in Africa, which is AMREF, Health Africa. And it's about the non-communicable diseases program. And if you open this website and see their model and approach for non-communicable diseases, this is actually a model which was adopted from work that APHRC had done in the informal settlements of Nairobi. And this is trying to make it possible for poor people who live in informal settlements and who don't always have access to formal healthcare for non-communicable diseases to set up what are known as community pharmacies that are based on on patient support groups, where they make a contribution and they're able to purchase drugs at wholesale prices, and then they actually sustain this mechanism into the future. And then again, UNICEF taking APHRC evidence and then designing their whole urban strategy. This is UNICEF Kenya, based on evidence that came from APHRC. And then the other thing is how this is a decision that by the Kenyan High Court, based largely on work. We are repeating it, and we very soon will have is enshrined in the Constitution. And then UNFPA going ahead to declare unintended pregnancies as a public health emergency. And then last but not least, this is a recent example of some work we've done about access to medical oxygen. One would expect that after a pandemic, we actually got our act together and medical oxygen is now something which is mainstream. Apparently not. And this is a study which was actually quite relatively small in scale, but has led to huge changes in trying to see what happened, where did the investments go, but also what can be done to improve access to medical oxygen for Kenyans, in this case, who need oxygen, whether it is during transportation, whether they are in ICU, or whether they are in the regular wards. So yes, research to impact, it's possible, but we need the right frameworks. We need institutional DNA that supports this kind of work. And then, of course, we need resources. Thank you very much. I hope I didn't take too much time, and I'm looking forward to the discussion and, of course, the other presenters' presentations. And I'll hand it over back to Lucho.
No, thanks so much, Catherine, for this presentation. And I think these are very concrete examples. You mentioned in your talk that resources are always scarce, but there is a lot of optimism when it comes to the possibility of creating impact. And as an organization and in our strategy, because the challenge is huge, no organization can do this alone, we are very keen on collaboration and partnerships. And for us, the new form of competition is actually collaboration. If you are looking for a disruptive thinker and somebody who actually thinks otherwise, you better follow Catherine on X and Blue Sky. So we're going to move to our next speaker. Please continue asking your questions, putting your questions in the Q&A and introducing yourselves at the chat. In the chat, we are moving to our next speaker, who is Professor Peter Singer. Professor Peter Singer is the founding CEO of Grand Challenges Canada. He's actually a board member of Grand Challenges Canada, a professor of bioethics, founding professor of the Department of Bioethics with the University of Toronto, and the immediate senior advisor to the Director General of the WHO. If there is somebody who can talk about measurement, I know Peter always says, get the shit done when it comes to SDGs, and I think he's actually going to tell us most of those. There is nobody who can tell us when it comes to the importance of measuring impact and how to measure impact when it comes to global health. We are very lucky to have you, Peter, and you have the floor. Thank you very much.
Thank you very much, Lucho, and it's great to be here with you and with everyone on the seminar, a very big group, and with all the other panelists. let me start by saying I just fully endorse everything Catherine just said. I thought that was an excellent discussion. I wanted to start by asking the question, why should we care about impact in global health research? And I think Catherine's given some excellent examples. In short, it's because we're not on track to achieve the development goals that we agreed to achieve as a world, the Sustainable Development Goals. 17% of those goals overall are on track, and actually 0% of the health-related Sustainable Development Goals are on track. So if you ask yourself, okay, well, that's not a very good record, how can we speed that up? As far as I can tell, there's really only three ways. One is through better governance, including in institutions in country and multilateral institutions. I'll talk a little bit more about that. Two is through better application of data to delivery, which is a form of research, actually. And three is through scaling innovation. And that's where I want to focus my talk. I'm not sure there's other ways that you can speed up impact. And so in my talk, I really only want to make 2 points. One is that a complementary frame to that research to practice, evidence to policy frame, which is extremely important, and I want to emphasize it's complementary, not competitive, is the frame of innovation, which is scaling and sustaining goods and services for impact. And they interact clearly because you need evidence before you scale. It's just a slightly different way of thinking about things, and maybe it correlates with some of those mental models that Catherine was talking about. Second point I want to make is there's now almost 20 years of experience in that, both in terms of creating a pipeline of innovation and scaling that pipeline of innovation in countries. And I want to talk about a little bit about that. And so where I'll end up is, and we have to learn from that experience if we want to improve on that experience. And where I'll end up is that all roads lead to Rome. And in this case, Rome is countries. And that's where I really resonate with many of the things Catherine said, the need to build people, resources, institutions in countries to actually solve problems within those countries. People solving their own problems is the only sustainable form of sustainable development. I'll be very brief on my first point because Catherine covered so well the issue of the research to policy, evidence to practice, research to practice, evidence to policy paradigm. And she beautifully highlighted the problem with it, which is it takes too long and very often it doesn't work. So if you ask yourself, okay, the output of that paradigm is knowledge. And again, what I'm going to say is complementary to it, not competitive with it. If the output of that paradigm is knowledge, can we think about a different way of thinking about outputs that are actually easier to scale? So what's easier to scale than knowledge? Easier to scale than knowledge is goods and services. And that, by the way, is the definition of innovation. If you take the Schumpeter definition of innovation, it is really the practical implementation of ideas that result in the introduction of new goods or services or improvements in offering of goods or services. Many definitions of innovation that have come since also stress novelty, they stress value add. And of course, the goods here are the health products, vaccines, drugs, devices, and diagnostics. But people often forget the services, which can be human services, services delivered by healthcare workers, community health workers. They can be digitized, they can be financially incentivized. And of course, these goods and services all have different regulatory pathways, and some are clearer than others. The pathway for a vaccine, for example, with WHO emergency use authorization, as we saw in COVID-19, is much clearer than the pathway for a service like the Friendship Bench in Zimbabwe, which is grandmothers offering cognitive behavioral therapy to improve mental health on a park bench. and the scaling pathways for goods are much clearer as well. I wanted to emphasize, though, that both of these goods, and when you think about innovation, you're usually thinking about products, but I'm usually thinking about social innovations or service delivery innovations. And let me give you a very concrete example of why you need both. About 10, 15 years ago, the Gates Foundation launched this Reinventing the Toilet Challenge. And it took a very technological approach. You know, they wanted to create the windows of toilets against the problem of water and sanitation. As far as I know, none of those high-tech toilets have actually scaled. At the same time, other organizations like Grand Challenges Canada were supporting social enterprises that were improving the value chain in water and sanitation, such as worrying about where the waste goes or how to repurpose or even sell and reuse the waste, such as in Haiti or in Cambodia. There's some concrete examples. The point I want to make is the Gates Foundation was going for a home run, the windows of toilets. No problem with that. High risk, but it may not work out. It was a product. Grand Challenges Canada was going for doubles and triples, to use the baseball metaphor. And if you have enough doubles and triples, you win the race. And if you actually look at the measurement of lives saved and improved by all the projects supported by Grand Challenges Canada, the number of lives improved of, for example, those 1,600 projects has a very, the water and sanitation and those, let's say 20, 25, 30 social enterprises that were supported have a very high stake in the numbers improved. So my point is, you can save and improve a lot of lives by promoting social and service delivery innovations alongside product innovations. And Grand Challenges Canada has this idea of integrated innovations, which is the coordinated application of science, technology, social, and business innovations. And if you think about how innovations scale, almost always that's the case. So that was my first point on balancing research and innovation. And now I want to move to my second point, which is there's about 20, 25 years of experience, both in creating innovation pipelines and in scaling them. And learning from and improving this experience, it can be very, very helpful in improving impact in health research, and now I would say in innovation. So on the innovation pipeline side, let me start with the Grand Challenges movement, which goes back to late 2002. I was minding my own business. We published a piece on top 10 biotechnologies in global health, got a call from the Gates Foundation that said they're thinking of launching their Grand Challenges in Global Health initiative. The scientific advisory board of that Grand Challenges, which I joined, published in Science their Grand Challenges, which of course is a targeted form of innovation. And then subsequently, through Gates and many other organizations, billions of dollars have actually come into global health research and innovation, initially through the Grand Challenges in Global Health, but then later we published Grand Challenges in non-communicable disease, mental health, humanitarian, and there's an ongoing effort at the moment by Grand Challenges Canada in climate, which is showing you the range of things that can be challenges that can be defined and supported. Now, this defines challenges, creates communities of innovators, but at the same time, and I want to stress this, the Grand Challenges movement has also created a network of organizations, including, for example, Grand Challenges Senegal, Grand Challenges Ethiopia, Grand Challenges South Africa, and then the Science for Africa Foundation cutting across Africa. At the same time, there was a group called the International Development Innovation Alliance that standardized definitions of levels of scaling, proof of concept, transition to scale, full scale, but also conceptualized and applied how you might measure success in scaling innovations. And the trick here is that the impact of innovations is in the future. So you actually have to model innovations like in a budget, like in a financial budget, and their impact, and then measure the success of those innovations, the lives reached, et cetera, against your model. One thing I want to emphasize is is that, when you think about many of those organizations, some supported initially, not so much anymore, but initially primarily health products and primarily researchers at Stanford, Harvard, London School, et cetera. Other organizations like Grand Challenges Canada, and this is also a bit the legacy of IDRC, supported with the majority of their funds innovators in countries themselves. I think 2/3 or of the funds of Grand Challenges Canada go to innovators in countries, which connects very much to the point that Catherine was making. Now, it's not enough, as Catherine was saying, to support innovators in countries. You also have to support institutions in countries. So some of the power shifting experiments that are being done, I think, and localization are very important here. Like, for example, last week, the Ghana Health Service announced a series of innovations in maternal, newborn, and child health, which it itself had judged from local researchers, but supported, in that case, by Grand Challenges Canada. So that's half the story on innovation, which is how you create a pipeline. And the point I want to make here is it's easier to create a pipeline than to scale a pipeline. And the Grand Challenges Canada experience, the Grand Challenges overall experience with those dozen organizations, is about creating a pipeline, and you can get it to transition to scale. It's reaching a few 100,000 or 1 million people, like the Friendship Benches, at proof of concept transition to scale with a few $1 million. But to truly scale something, you need to find those innovations that are reaching 1 million people and scale them to 100 million people. And that's where, for example, multilateral institutions like WHO come in. So when I went to WHO in 2017, that's what we tried to do. The strategy, the 13th General Program of Work, for example, that came out in 2018, says WHO can take a unique role in catalyzing, scaling up, and sustainability of health innovations. Tedros, in his speech at the World Health Assembly in 2022, laid out a goal of WHO scaling 5 innovations to 5 million people each within 5 years. I think that's a modest goal, but it shows you how you don't have to scale that many innovations to have a really big impact. And it is the 20, 10%, 5% of innovations that are really taking off that you want to get behind, I think, and support. The core concept, as I said, is take the innovations already scaling to 1 million people, especially for social innovations or service delivery ones, where the path isn't so clear, and work with domestic governments to scale them to 100 million people. Domestic governments, but also the private sector, because health is delivered through both channels. In a sense, I'm talking about marrying the whole Grand Challenges movement with the whole multilateral movement. And of course, there's also other examples other than WHO, like UNICEF procurement of oxygen, the World Food Program Accelerator, the UNDP Accelerator Program, culminating now in something called UN 2.0. And I think this is the role of multilaterals, which is, yes, to help countries scale vertically. But those multilaterals are the only organizations that work across 194 countries. So that horizontal scaling is also super important. The experience at WHO on this, I have to say, has been mixed. You know, there's sentinel examples through the WHO Innovation Hub, like scaling solar-powered oxygen in Somalia. But it's proven quite difficult. And I think looking at some of those barriers is super important to improve this side of the equation. And some of those barriers are, for a long time, people in a multilateral seem to think innovation's only about culture, only about human resources, primarily about digital, primarily about science. It is about all those things, but most fundamentally, it's about impact. And those ways of thinking can really limit the utility of scaling innovation in a multilateral. Coming to the end of my time, I just want to sum up and say, I think we could have greater impact if we could shift slightly our thinking from research and evidence to practice alone to also thinking about generating and sustaining innovations, because that whole innovation system I described is a way of managing risk. You take the best 10% of proof of concepts, 10 or 20%, and transition to scale. You take the best small percentage of that and really scale to 100 million people. It's a way of managing risk. And secondly, to take those lessons, both from creating pipelines in the Grand Challenges movement writ large, and I'm not just talking about Gates here, I'm talking about 12, 15 organizations, and I see the Novo Nordisk Foundation, and Catherine was speaking there, is recently also taking this approach, the largest foundation in the world now, to experience in scaling innovations, experience in creating innovation pipeline, but also the earlier experience in scaling innovations in multilaterals. I said I'd end by saying all roads lead to Rome. And that's where sustainability and the importance of national systems comes in. And this is really where I connect most closely with what Catherine was saying. You know, core to these issues, you'll never scale innovation in a country if you don't have national leadership, including in government, including in science, including in research. For me, the most frustrating thing is when an OECD country like Canada sets out to embrace innovation, it sees it in terms of prosperity, in terms of jobs for young people, et cetera. When we think about it in terms of development innovation, we often think about it as development and charity, and there's a fundamental disconnect there. So until domestic governments really see innovation as the pathway to prosperity and jobs, and also health and social impact, we won't really crack this nut and invest in it, by the way. Let me end with an example. One of the most inspiring conversations I had was in the last year or so was with Austin Denby, who's the health minister of Sierra Leone. And when you look on Wikipedia, it says Sierra Leone's maternal mortality ratio is about 1,200 per 100 live births. When I spoke with him in September, he said, no, actually it's about 400 per 100 live births. And let me tell you how we're going to make it lower. We're going to use a digital data system that helps us identify every pregnancy in Sierra Leone, whether it's in a high-risk pregnancy, where we'll mark it in yellow, or whether, unfortunately and sadly, it's a maternal death, where we'll mark it in red. On the red maternal deaths, we'll do root cause analysis. On the yellow, we will follow those pregnancies, send health workers there, especially when they're geospatially clustered. And that's how we're going to get down from 400 to a much lower number. So I said, oh, so you're going to go to 140 per 100 lives births, which is 100,000 lives births in terms of maternal mortality, which is kind of double the SDG goal of 2030. And kind of the maximum allowable, if you will, SDG target. And he says, no, we're going to get to 70 per 100,000 live births in that system. And that's the kind of drive and leadership domestically in country that will cause us to succeed. And what I want to point out is that whole Grand Challenges movement of creating innovation pipeline, that whole multilateral and WHO effort towards scaling innovation is or should be oriented towards supporting people like Austin or supporting people like Mohamed Pateh to identify the innovations, identify, select, fund, and scale the innovations they select, they see as most useful against their own health priorities in their own health systems. Thank you very much. And let me just say some of these ideas are explored at greater length on my blog at singerp.substack.com. You can go there now. You can subscribe for free. Put it in the chat. And I really look forward to the other speakers and to the question period. And I'll just stop right there, Lucio. And thank you so much. And look forward to the questions and comments. Thank you.
Well, thanks so much for this very insightful presentation, Peter. It's startling to know that 0% of SDGs are actually on track, and it was very interesting to insist on the different way of thinking innovation, the importance of service thinking, service innovation, and most importantly, I think you mentioned the role of multilaterals when it comes to impact and the importance of rethinking the expectations and the roles of these multilaterals when it comes to impact. Please continue putting your questions in the Q&A and introducing yourself. We're going to get another presentation, then we're going to answer a couple of questions. Thank you. So our next presenter, all of us know that if there are two ideals when it comes to global health or global health as a concept, we have to think about solidarity and we have to think about equity. And we have Dr. Magda Robalo, who is doing amazing work in actually closing the equity gap when it comes to the discrepancies that actually exist in the continent when it comes to language. She's doing amazing work in actually advancing global health science in the Lusophone countries. Dr. Magda is the co-chair of the Universal Health Coverage 2030 Steering Committee. She's the president and co-founder of the Institute of Global Health and Development in Guinea-Bissau. She's an infectious disease physician and public health physician with an experience of over 30 years, a former director at WHO, former country representative at WHO, former minister of health in Guinea-Bissau, and actually a board member for management sciences for health. If there is one person that can discuss the impact that can discuss impact when it comes to global health, I think Dr. Magda is well placed to discuss this. So Dr. Magda is going to walk us through on the implications of conceptualization when it comes to matching research in global health to impact. We are happy to have you, Dr. Magda. Thank you very much.
Thank you. Thank you so much for having me. I'm really delighted to be joining this webinar, and I'm pleased to bring to you some few discussion ideas as we, may I kindly ask you to pass my slides? I don't see options here for me to share my presentation. So I was saying...
yeah, I'm trying to get the slides.
Okay. It is really a pleasure to bring ideas to discuss with you on how do we define the impact of global health research, how do we measure it, and how do we attribute such impact to looking back the road into the original research that generated the intervention, which is being indicated as the causal effects of the impact observed. You bear with us for one more minute and we will get going. Wonderful, thank you so much. So the title of my talk is when is global health research considered impactful? Of course, this, if we could make it full slide. The question implies that not all global health research is impactful. And we know that there are many reasons why research is not necessarily impactful, but because we don't measure the outcome of the research we do, it is difficult to know which ones are impactful, which ones are not impactful. In the next slide, I'm bringing you just published results reports for 2023 from the Global Fund. This slide is not meant to laud the Global Fund or to make any publicity around the work of the Global Fund. The reason I'm bringing this slide to you, to this conversation, is for us to reflect on the impact of research. As you know, AIDS, tuberculosis, and malaria are the most pressing health issues in the African continent. People die and get sick of HIV, tuberculosis, malaria. Of course, maternal mortality is also one condition that is afflicting the countries in our region. And Peter has just mentioned the example of Sierra Leone and how the Minister of Health is intending to bring 400 per 100,000 live births mortality to 70 per 100,000, coming down from a very high 1,200 women dying per 100,000 live births. So if we, in 2023, hear that 65 million lives have been saved, of course, not all these lives are from the African continent, but majority of these lives are from the African continent, because most malaria cases, 90% above, are and deaths are on this continent. The same for HIV and TB. Of course, Asia is ahead of Africa, but we still have a very large disease burden when it comes to tuberculosis. The Global Fund in this report is telling us that 25 million people are on antiretroviral therapy for HIV. 7.1 million people have been treated for tuberculosis, and 227 million mosquito nets have been distributed to protect families from malaria. This slide is very rich in a sense that it is hard here for us to attribute impacts on the lives that have been saved to the interventions, be it antiretroviral therapy, be it treatment for tuberculosis, or people sleeping under mosquito nets. But all these interventions, for sure, they come from research. Many of you must probably remember in the late 80s when trials were done on the impact of insecticide-treated mosquito nets in reducing malaria mortality in Africa. You all remember when the first antiretroviral medicine, AZT, became available in the late 80s as well, and of course wasn't available in Africa at that time. So 30 years ago, and for TB medicines, we are talking even more than 30 years ago. What's the pathway we have walked from the research that was done to reach 2023 and talk about 65 million lives that have been saved? In the next slide, I'm trying to bring to you some of the questions that we need to interrogate. Next slide, please. The questions we need to ask ourselves when we reflect on the impacts of research is, what impact are we talking about? What kind of impact are we talking about? May I please have the next slide?
Sorry, I'm trying to move the next slide. Just a second.
Place the cursor in the presentation. Could have moved.
Good.
Thank you. So for us to answer the question on whether or not global health research is impactful, we really need to have a clear definition of what do we mean by impactful research. There are several ways of looking into the what research brings into the lives of everyday people. Sometimes we just talk about processes, improving processes as a result of research that could contribute to improving processes within the health facility, within the hospital, for example, and that could bring some improvement in the way people access healthcare and ultimately have an impact on their lives. We could be talking about outputs, outcomes, or actually real impacts on people's lives in terms of reducing disease burden, in terms of preventing them from dying of a specific disease. We could also be looking into return on investment. We have done a research of $1.5 billion across multiple trial centers on the continent, a longitudinal study that takes quite a number of years for us to come up with the result. If we think of the malaria vaccine, for example, it has been several years of research on malaria vaccine, and today we have two malaria vaccines being used to prevent mortality and reduce morbidity on malaria. But the impact on research could also be measured through how much knowledge has been generated, how many masters and PhDs and publications have been made. Is that what we are talking about? Is that what we want? How social, environmental, and economies have been improved through global health research? Is the society more equitable in terms of access to healthcare, access to the well-being generated by economic growth? So it is important not only for us to define what do we mean by impact, how do we measure it, and then how do we attribute the impact to not only the intervention that was implemented in the first place, but the actors and those involved in that research. I think my next slide is the last but one. I'm about to conclude this presentation, which, as I said, was meant to generate discussions on how do we go about defining, measuring, and attributing the outcomes of research. If I may have the next slide, which brings also considerations on how do we initiate the research that we intend to purposefully do with an eye on the impact it can have on people's lives. Is it founded on collaboration and respectful partnerships? Who's actually framing the question we are trying to study? And this is where also I want to pause here to applaud APHRC for the great work they have been doing over the past 20 years, and a big round of applause to Catherine Chumutunji for the peerless way she has been leading APHRC. Are we talking about impact from low resource settings, high resource settings? It's clear that we, in our context, is essentially low resource settings, but what do we bring from high resource settings? The tensions that we have within the research landscape, the 10/90 gap that still persists. Is the research responding to a specific need of a specific population? Is it relevant? How is it going to be translated into the majority of countries within the region or within the continent? And when it is published, so what? Who has access to it? How does that contribute to improve the lives of the people we are trying to improve? So I think from this webinar going forward, and that's my last slide, I would like to suggest to APHRC, and I'm sure they're already thinking about it. I think we need a working group. We need to move fast into having, thinking about the framework that will help us define, measure, and decide on how, from the way go, from perspective, the design moment of any particularly major global health research that is done on the continent, we have in view how are we going to measure the impact of this research, and then invest time, energy, people, resources, institutions into medium to long-term measurement of the impact of research on the continent, and be also on the look for ethical issues, for accountability issues, for governance issues that sometimes make some of the research that is done on the continent not relevant and therefore shouldn't be supported. I will stop here and we'll be happy to continue discussing with you. Thank you.
Thanks so much, Magda, for the very interesting presentation. And I think a couple of things still actually stood out, like the need for this framework, the law of the continent to measure impact, to actually have clear measures when it actually comes to impact. And I think that network, I'm happy Catherine is here, and as an organization, we are very intentional about that. I'm happy you are also here for cooperation and collaboration to come up or to lead with such an initiative. Thanks once again. Maybe here there are some questions in the chat. I'm going to ask a couple of questions that have been asked. Any of the panelists, please feel free to give an answer. The first question is, are there areas of research that are much easier to translate into policy? And if yes, what are the facilitators? Are there areas of research that are much easier to translate into policy? And if yes, what are the facilitators? The second is it possible to actually gain impact without actually strengthening the research institutions or institutions in country? And the last, I think, Magda, you mentioned it, was actually when it comes to measures of impact. So panelists, feel free to take any of the two questions above. Thank you. Yes, Catherine?
I actually responded in the Q&A, but there are issues which are more difficult than others, maybe. So everything else can be assumed to be easier. And I'll just give two examples. Issues where perhaps the underlying mental models in society are at odds with what the evidence says. And I'll give you an example of things like sexual reproductive health and rights, especially for young people. The mental models in society are very much at odds with what the evidence says, what needs to be done, maybe to reduce or prevent teenage pregnancy and all that stuff. So if you're pushing evidence to change policy in that space, you should be ready for years and years and years and years of engagement, because you can work for 10 years and make progress, and then one government comes and the new Minister of Health has a completely different mental model, and they'll throw everything into the dustbin. So I think that's one example. Then the second example is around things which there are lots of economic or commercial interests around issues. You always get pushback from the industry. So there's a phrase around commercial determinants of health. If you're trying to reduce sugar in beverages, you'll get a lot of opposition. Some of it explicit, some of it not so explicit, from people who put sugar in beverages. So I think that it's easier to identify things which are harder. And then the less controversial, maybe those which don't have a lot of commercial interest or which don't have very, very strong commercial players, could be easier. I hope that's helpful, because there are so many issues. It has to say, this is easy, this is easy, this is easy. I think there's a frame of what is hard. So if you're going in there, then you're ready, and then you can assume that everything else perhaps is easier. Over.
Yeah, thanks so much, Catherine. I don't know whether Magda or Peter, you have a comment on that. Thank you.
Sure. I just, again, reinforce what Catherine said, and excellent talk, Magda. It's a privilege to be with you as well. Looking forward to the others. I think the easiest type of research finding or innovation to scale is one that's already a priority to the domestic government. That's just a different way of saying what Catherine said in terms of when governments change, their priorities change. But if something is on the priority agenda and you have something to contribute to it, that combination of, let's say, the political priorities with the technical work is what will make something really go. And on the question of strengthening, let's say, research and innovation systems domestically. Can you actually scale innovation? Can you have research to impact without strengthening innovation systems? I think there's always a chicken and egg, and they're highly complementary. You know, Magda mentioned the Commission on Health Research for Development from 1990 and the 1090 gap. One of the key findings there was the need to pull together, they called it capacity strengthening with problem solving. And it's a virtuous cycle. So without actually having a real success, like you've scaled this oxygen thing, or some of the examples that Catherine gave, you've scaled this oxygen thing, you fixed this food system thing, and you've saved X million lives in that country. Without having that success, it's hard to have the momentum to invest in the infrastructure and institutions. On the other hand, without investing in the infrastructure and institutions, it's much harder to have that success. And it's certainly impossible to have that success in a sustainable way without those domestic investments. So I just wanted to say they're very closely linked. They're kissing cousins, and one reinforces the other and creates a virtuous cycle, mostly on country priorities. And just a tiny point, Magda made some great concrete points about lives saved and the different types of impact on HIV, malaria, tuberculosis. And I fully agree with all that. At the same time, we know that 70+% of deaths in the world are from non-communicable disease. And I put in the chat some modeling we recently did, very preliminary, not yet fully peer-reviewed, that shows you could save 943,000 lives per year through global access to these GLP-1 drugs, Ozempic, et cetera. And that's on the same order of magnitude as ARVs for HIV, and only slightly less than three times less than childhood vaccines. And so I think we have to look across the spectrum of priorities. And on the other issues, Magda talked about the measurement. I just put in the chat a 2017 paper from the International Development Innovation Alliance that sets out a methodology for modeling the future impact, actually, of innovations. And I use that example because that's a coalescence of, I think, a dozen or 15 development funding. You know, I don't want to go through all the technical details, and Magda did a beautiful job dissecting out some of the things. But if you want to read more, there's some stuff there. So, Lucio, back to you, and I won't take any more time because looking forward to hearing from Robert and Alphonsus and others if I've got the hit parade right. And thank you again for the privilege of being with you at 5 a.m, by the way, in Vancouver.
No, thanks so much. Thanks so much, Peter. I appreciate you and Robert from Canada. We really appreciate that. Maybe Magda, some comments on the question before we move on to our next speakers. Thank you.
I think Peter and Catherine have been wonderful in answering the questions. One thing I wanted to add here is the silos that we continue to work in. I think global health research needs to bring on board more health economists, more people working on economics. We need to bring on board more social scientists, and that will actually improve the impact of, or at least the uptake of research outcome, translation into policy, dissemination, and eventually lead to the impacts that we are expecting. We remain very much siloed, and that doesn't help to achieve impact.
Well, thanks so much, Magda, and I completely agree. Everybody is saying we should move towards transdisciplinary approaches, but I don't think this is actually matched with practice, as you actually mentioned. And I agree that we really need a lot of health economies, because if you think of the impact of climate change on health, these are things that are completely complex. We need a lot of resources, but we cannot invest on everything. But actually doing some economics work to actually come out with priority areas where we can have highest return on investments could be very, very useful from an economic point of view. And I'm going to transition now to my former colleague, Robert McLean from the International Development Research Center, where we're actually doing some work on the economics of climate change and health. So Robert is a senior program specialist in the Global Health Division of the International Development Research Center, former senior monitoring and evaluation specialist at APHRC, with a huge interest in creativity and how creativity can help actually build a strong world. Robert got his PhD from the University of Stellenbosch in South Africa and did his postdoctoral work in the University of Ottawa in Canada. If there is somebody who is a leading figure when it comes to scaling science, I cannot think of a better person other than Robert. And Robert has written a very important book, and I have it here. The title of the book is Scaling Impact: Innovation for Global Health. We have been having discussions, yes, and if we have all of these interventions, all of these proofs of concepts, how do we scale them? So Robert is going to come to advise us, give us key insights when it comes to scaling. How do we scale innovation? What is scaling in global health? Over to you, Robert. Thank you.
Thank you so much, Lucho. Thank you, Lucho, Catherine, all of the hosts at APHRC. It's really an exciting privilege to be here today. And thank you to my co-panelists for the excellent talks. I think that's I'm learning so much, feverishly taking notes here myself through the first talks. I'm looking forward to more. I'm just going to share some slides to kick off my talk. So I think that's in presentation mode for everyone and should be looking okay. Let me know if not. But I am going to talk about the concept of scaling impact, and specifically when it's aimed at the public good. I think that implies some important nuance. I think this talk is going to follow really nicely, and I'm going to try to just build on what Peter has suggested around scaling to kick us off and what Magda elaborated on around impact. So I hope I find a way to bring these two concepts together and share a little more about what I've been learning and what we've been learning at IDRC on this topic. I'm going to present a few principles that should help put this into practice. And I'm going to suggest an important role for researchers in this space, and I'm calling that scaling science. So I'm going to start with some pushback, though, because as I've been studying this issue for over a decade now, I'm becoming increasingly frustrated with some very simple misconceptions that exist in this space. And the first is that impact is a trustworthy method. And so this notion that, we search as researchers, we look for this solution and we find it, and we pull it out in its box, and we can just stack it, and it has a certain impact that's constant. So then we can just double it, we can triple it, we can quadruple it, we can draw a straight line, and we're increasing impact by doing the same thing. And of course, as researchers, we have this notion that context changes everything. Complexity comes into play, and impact is an amorphous, fungible, emerging notion. And I think this is a really important place researchers need to speak to implementing agencies about how to do and scale impact better. But this is almost increasingly worsened by this notion of what I call magic ratios. And so I've been studying this school early childhood development program, and they were claiming that there was a social return on investment of over 8%. And the notion was basically that you could draw two lines now. You could talk about the value in dollars that your impact was having, and you could talk about the amount that investors were putting in. And so you could say that we're here on this plot, and if we just increase the amount of investment, we can draw that straight line. And of course, as we've studied what happened with this program and how it began to grow and create magnificent impacts, the straight line didn't hold. And there's not this notion of impact being constant over time like this. And so I think this is leading towards a challenge in our field that as researchers, we have an important role to unpack and improve. And it's something I'm calling the simple commoditization of impact. And this is not to say that buying and selling impact on markets or quantifying impacts is a bad thing. I actually argue that's incredibly important to fully understanding and maximizing impacts we want to have. But I think there's a push towards this simple view of what impact is. And as researchers, we have a role to do better. We've thought very differently about how change is created over time in the world, and we can apply those strengths to what we're doing in the impact sphere. And here's where I want to introduce a concept called scaling science. So scaling science is a purposeful play on words. It's about scaling the impact of science. So scaling our scientific research results, they have impacts in the real world. But its double meaning is to also concurrently study or use science to understand that process of scaling impact. So to study the way that scaling happens so that we can get better, more sophisticated about how we implement our research so it will be impactful. And what I'm talking about today is evidence-based. It's based on over a decade of work we've been running, both at the APHRC and elsewhere. And I'll share some of that over the talk. And so just to give it's easy to put things in boxes when you're giving a talk. And so I'm not pretending that it's this simple. But as Peter was saying, I think this notion of scaling is really complementary to other domains of science. And I really believe that. This is not to say that it's an improvement on implementation science or on the important role that discovery science plays in society, but it's a complementary way we might go about approaching scientific inquiry and actually get closer to notions of impact with the work we're doing. And so I won't go through the details in the box, but you can see how it actually shifts the way we're motivated to do work, the way we do it, the audiences we engage and we share our results with, and what those results actually are. And I think there's important implications of thinking about the scaling science as a complement to applied or implementation science and discovery or curiosity science. And we've written about this in this book, which Lucio, I'm so happy to see you sharing. And really what's in this book are an elaboration of what we've been learning about the research on the topic. And so we offer a framework in 4 principles, 5 case studies to kind of illustrate how that work plays out in the real world, around the world. And I think the main argument is a shift in mindset, which is what I want to open up today. And for those of you whose first language is French, I'm very excited that it's been translated to French by the University of Montreal. And the great news is it's free in open access. So you can use the QR code here, or you can just type scaling science into Google and you should find a link there. And I invite your feedback, your critique, or any ideas you have that want to push this field. I think it's a really exciting place for researchers to get involved, especially we're seeing a big push around this field from the Global South, and I'll unpack that shortly. So Magda did a fantastic job elaborating on impact, and I thought I'd spend a bit more time talking about what scaling means to us. And I often joke with my co-author of the book that we named our book Scaling Impact, 2 of the most loosely defined terms probably in our field. And so we put them together and it's even more confusing for colleagues. But I'm going to unpack a little bit of what we think we're talking about when we talk about scaling for impact. And so traditionally, there's lots of different definitions in the literature, and I'm going to summarize and talk about things like scaling up, which is generally about throughput. So it's about doing more of a good thing. You might grow the size of your clinic, hire more staff so you can serve more people in your community. It's also the notion of scaling out. And scaling out is generally about replication, expansion. So you may create a similar clinic, offering similar services in a neighboring district or country. You could do the same with policies that show promise or products that are promising. Talk about scaling deep a lot in the literature, and this is generally about quality. And so quality improvement methods, it could be, in this case, leaving the apple on the tree longer so it grows larger and tastes more delicious. It might be about increasing accessibility of that clinic to new members of community, or increasing the options that a policy has for different members of society. Of course, these things are not mutually exclusive and they happen at the same time, more often than not, I'd argue. And so you could scale up and out at the same time, in any combination thereof. What's talked about quite a bit less in the literature, however, is a notion of same scaling. So really understanding when the innovation we're using is at its optimal level of impact. What's talked about even less than that really is a notion of descaling. And so how do we know when it's time to do less of the innovation? Maybe a better than solution has come along. Maybe it's time to devolve and allow other players to offer another impactful innovation. Oftentimes, you see there's a lot of struggle around this in the real world. Sometimes it's better to stop altogether. And the one thing that you see a lot of in practice, but unfortunately is very poorly described, is this notion that we're calling not scaling. So doing things that superficially look or feel like we're scaling, but really don't have the same impacts for people or our planet. And I think that's where kind of the main message, the argument I want to make comes through. I have to be very brief about it today, but it's really that any and all of those methods, except not scaling, are appropriate to bring innovations to impactful scales. But what really matters is not the focus on the operational means of scaling. So whether we're scaling out or up, those are important plans to draw, but really keeping a focus on scaling impact. So as Magda defined it, these changes that have a variety of different measures in all cases and mean different things to different stakeholders in a problem space are what we're actually thinking about scaling as we design that innovation and as we pick an operational scaling strategy for it. And so as we've looked at projects around the world, we think this is really showcasing a different mindset around how you scale. And we've learned some very exciting examples of how to bring that mindset into research and actually build it in from the start. And so we've summarized a lot of what we've learned into 4 guiding principles. And guiding principles, very briefly, offer a very unique framework because what they do is allow for localized, contextualized decision-making while connecting actors at a higher level. So it's not a framework that says, here are your 4 steps from small scale to large. It's a framework that helps you navigate decisions as you move through your own scaling context and scaling challenge. And so those 4 principles are laid out as justification, optimal scale, coordination, and dynamic evaluation. And those are words we've used to describe them, but each of these notions have really been found to be facilitators in research that does reach optimal impact and in a lasting way. And so we've put them together in that sentence at the bottom to kind of provide a definition of, for what us scaling impact really means. And so it seems as though they're, separate domains and each principle should be addressed on its own, but really they intersect. And when you use these as a researcher, you look for strategies to bring them out at different times in your research process. And I'll speak to each just very briefly, but they're unpacked in full in the book. And I'd be super happy to talk to anyone more about how these can actually shift the way we think about designing research projects, research programs, research institutions. So justification basically lays out this counter argument to the scaling imperative. Scaling is always a choice, and we want to share that choice both with the funders who have the means to make scaling happen, with the researchers who actually find the solutions that might be scaled to generate those impacts, but also those who are impacted and having a solid understanding of what impact matters to them and how they feel it. Optimal scale says that bigger really is not always better. And rarely does one solution hold across multiple disciplines. And we need to find ways to balance different solutions to find different types of impacts. Secondly, optimal scale, as Magda really nicely pointed out, creates a collection of impacts. There's really just one impact. And so we think about different ways to measure that impact is generated from research. And magnitude is probably the most cited one. You think about numbers of lives saved, numbers of bed nets handed out. These are different measures by magnitude. But each type of impact has different ways it's felt by different stakeholders. And so variety of impact, one intervention may have an economic impact and have a health impact, and different stakeholders will find different value in those 2 impacts. And so we're really arguing that thinking through the variety of impacts created by research is an incredibly important step. Sustainability deals with rigor and how long that impact lasts over time. So scaling over time, not just place. And equity deals with fairness. And so who's being impacted, who's being left behind. Coordination really lays out that notion that scaling is always happening in a complex system. So I think this speaks, Catherine, to your systems model for APHRC, and I think that's very exciting. And that requires flexibility in how we approach scaling. Rarely is the plan from the beginning, those 5 steps from small to big, going to actually be the way we go through a scaling cycle. And coordination also encourages researchers to connect with the evolving set of actors that make scale happen. And evolving is an important word here. Oftentimes we set out to do research projects with our knowledge users. But we all know from doing this kind of work, those knowledge users may not be the same on the first day of the project as they are 5 years later, where we're actually trying to move our knowledge into implementation and hopefully impact. Finally, dynamic evaluation suggests that learning is essential to any scaling process, and that scaling itself is something that can be evaluated and should be. So if we're thinking about generating impact with a research project, let's not just think about the results and measures of the work we're doing. Let's think about that scaling process itself and what we're learning. Who are the new actors we need to connect to? Who are the new competitors entering into our scaling system that we might want to be mindful of? And all of that just really reflects a dynamic view to approaching evaluation. So types of evaluations that are often used: impact evaluations, randomized control trials, formative studies to learn. These are all important aspects that might be part of a dynamic evaluation stance that we hold before, during, and after scaling. So it's kind of a whirlwind explanation of these 4 principles. I'm very excited that we're actually putting those into practice now in a very practical way with researchers, and together with a kind of development team, we put together this scaling playbook. It actually introduces those principles and talks about how they can be interlaid into a typical research process from the very start, from writing research questions that are impact focused, to the way we analyze data to understand who's going to benefit from what we're learning, and what are the most important elements of that data we want to highlight and bring out, to the way we share the results of the study. So how we're actually developing strategies to get that research used and get it to an impact at optimal scale. I think it's a very exciting addition to our more standard views of implementation science and research use. And research impact is really pushing the table further. So in that are a number of heuristic tools, and here's just an example of the way you might actually implement that coordination principle practically in your research project. And so there's others around setting out an optimal impact and thinking about that right from the beginning of your project, and the different measures you might need to collect, as Magda and Peter were talking about, to be able to demonstrate that to your different stakeholders. I'm excited this is finding its way, around the world. And major funders like the Bill and Melinda Gates Foundation are implementing the approach into work they're doing. But I think what's possibly the biggest kind of push for me today to keep this field going and talk to you today is the uptake it's having in the research and practice community. And so the Scaling Exchange, another play on words around changing the way we're thinking about scaling, came together and brought innovators, researchers from around the world. And you may notice some of your APHRC colleagues here were leaders of this gathering, and outlined different ways of thinking about scaling with a strong focus actually on how this is a different concept in the global south than it often is in the funder world in the global north. So you can check out this website, scalingexchange.org, and you'll see they've published these 8 actions that really are actually addressed to funders, to implementing agencies, to really say, hey, we've got to think differently about how we're supporting scaling if we actually want this to come about in the global south and have real meaningful impact in people's lives. And some of these actions here, I think, are just incredibly exciting. I mean, keeping that focus on scaling impact rather than the operational means of scaling up or out, which is important, but rarely does that actually lead to impact on its own if we don't focus on impact from the start. Participation and bringing voices into scaling processes. Addressing the environment as part of the scaling system, and how much the environment and health, we're beginning to learn about these intersections in great depth now. thinking beyond funding projects and really funding impact as funders, an important push, I think, and one we've yet to grapple with really as funders around the world. This notion of scaling what works doesn't really work, and we need to support a learning culture instead. The importance of Southern solutions and actually identifying what should be scaled and how it can be scaled. And finally, 8, the investment in the science of scaling has been personally very excited that we need to actually keep studying this to get better at scaling as a field. And there's a role for researchers to build on that. And I second the comments in the question period there around all types of researchers, social scientists, economists, who can help problematize and find solutions to how challenging scaling can be. But I think there's an amazing opportunity of ingenuity here to kind of change the way that we're going to achieve the SDGs. So I'll wrap up there. That was a whirlwind of a lot of work we've been doing, and the website is there on the page. If you'd like to learn more, I'd love to be in touch and keep chatting. And I thank my panelists for the previous presentations that I hope I've been able to complement. And I'm looking forward to questions and the upcoming presentation too. So thank you everyone very much.
No, thanks so much, Robert, for this very exciting presentation. And I think I picked up 3 very important points. The first was the importance of thinking differently. The second was, and I think it's really important for us here at the African Population Health Research Center as a research policy organization, when it comes to impact-focused research questions and actually expounding on scaling science as a discipline. And having Nigeria, APHRC as a long-term partner, we think these are further areas of collaboration that we're going to explore. Thank you very much for this exciting presentation. I am going to move to the very last presentation of the day, then we take a couple of questions. And this presentation is going to be made by Dr. Niba Alphonsus. Dr. Niba Alphonsus is a thought leader in science funding, intellectual property and research commercialization here at APHRC. He's the director of the Catalyzed Impact Initiative and does a lot of work when it comes to actually preparing the research and development ecosystem in the continent to be able to produce impactful research. Yes, we want to do impactful research. Yes, it's complicated, but how can we prepare an ecosystem, render the system or the ground fertile for the research that we do to create impact? We are happy to have Dr. Alphonsus Niba to lead us through this discussion. Thank you very much. Over to you, Alphonsus.
Thank you very much, Lucho. I hope everyone can hear me.
Yes, yeah, sure.
Okay. So I just want to take a moment to thank the previous panelists for their presentations. And then I would like to start from the end, coming to the beginning. So by the end, I mean starting with scale, to argue that scale or scaling requires a particular environment, quality environment and quality R&D ecosystem for it to succeed. If you move now to measurement, it equally requires a particular type of environment and an R&D ecosystem to succeed. And then when you move at the very beginning to conceptualization, it also requires a specific kind of environment for it to be very, very successful. And therefore, the pursuit of impactful global health research is intricately linked to the quality of the research environment and the R&D ecosystems that support and nurture it. So if we take, for instance, an example of a typical robust research ecosystem or R&D ecosystem, you'll find out that it is made up of a very strong and solid institutions, very productive and skilled researchers, a lot of funding and mechanisms to manage funding, a lot of government support, a lot of other ingredients that actually make it very, very possible for impactful research to take place. And therefore, I'll spend the first few sections of my slide just trying to go through how quality research environments, and I hope my slide is moving. Let's see.
No, it's not.
It's not moving. Okay.
Now it has.
Just to explain a bit how quality research environments and strengthened research ecosystems actually contribute in the measurement, in conceptualizing measurement and scaling in global public health. And the next part of my presentation, I'll just spend a bit of time just explaining how one of our programs at the APHRC is actually strengthening research ecosystems to ensure that global public health is more impactful. So if you take the very first one from the screen that you're seeing, quality research environments, I've actually mentioned here that they actually provide researchers with resources. They provide the support and infrastructure to make everything happen, in addition to providing access to funding, facilities, and mentorship, just to name a few. In terms of strengthened research and development ecosystems, we have where they facilitate collaboration and partnerships in global public health sector, and they also provide access to resources and expertise. Of course, this in addition to translating research into policy and practice, and also connecting policymakers to required data and local expertise. In terms of conceptualization, quality research environments are very important in the sense that they provide or they foster innovative ideas by providing access to cutting-edge tools, data, and intellectual exchange, in addition to promoting interdisciplinarity and collaboration. Then in terms of measurement, there's the importance of reliable and valid measurements of impact, which requires rigorous research methods, including research designs, high quality data collection, and advanced analytical techniques. In addition, we can mention strengthened R&D ecosystems, which also promote the use of standard metrics in terms of measurement. And then for scaling, quality research environments are very important in the sense that they support scalability and sustainability, and they provide robust infrastructure, effective dissemination strategies, and the capacity to adapt to diverse contexts. And of course, this is in addition to identifying best practice for scaling up a lot of the findings. Now, coming back to the second part of my presentation, I just want to share a bit of perspectives from the Catalyze Impact Initiative, which is a program that we're implementing at the APHRC that is actually asking big questions on how to strengthen research environments and research ecosystems, and actually coming up with interventions to address whatever gaps that are identified and make sure that whatever research to policy or other impact actually becomes of high quality. So the very first intervention is an institutional research readiness assessment framework that we have developed that actually provides an institution the opportunity to self-introspect and find out how ready they are to conduct impactful research. It provides them that opportunity to find their gaps, and then to also make recommendations on how to address those specific gaps in order to ensure that they are now ready to be able to conduct research. We've been able to administer over 7,000 questionnaires across the continent, and we have a data set of about 700 completed questionnaires at the moment and counting. And just wish to state that no other institution around the globe has got the type of data that we have, and we're actually looking forward to analyzing that data to find out just how we could strengthen that type of, or strengthen various institutions to ensure that health becomes more impactful on the continent. Another area that we have been busy with is to strengthen African journals. Of course, we all know the issue about the perception of African journals as being of poor quality, largely ignored by global indexing services. And we're coming up with interventions to ensure that we could identify them, which we've already identified about 2,000, build the capacity of the various journals and the editorial teams, and ensure that they meet the relevant standards to be able to index. And of course, this has a lot of good implications in global public health, because a lot of important work is done on the continent and published in these journals, but doesn't really make it anywhere else because they are largely looked down upon. And if we could bring this important research to the global public space, then I think it would contribute a lot towards improving global health as a whole. And then the other aspect that we're working on is the good financial grant practice, again, which actually helps institutions to be able to improve financial governance. We know very well that a lot of African institutions are unable to attract and manage large grants, and that in itself has a negative implication on the contributions of African institutions towards conceiving, measuring, and actually scaling health research. And therefore, by building their capacity to be able to absorb and prudently manage large grants, this intervention too is providing that environment for global public health to strive. The next one, the most consequential one so far, is the Africa Research Connect. I've put up a link just in case, not sure whether you can see the link, but I'm just trying to go a step backwards.
It's on the slide, Alphonsus.
Yes. So, okay,
but
if everyone
we'll
can
post
see
it in the chat also.
Okay, so you're able to probably get into it and see if you can find yourself. So this is a platform that profiles African researchers and African research institutions and bring them into a one-stop shop where you could get any information on any issue, any country on the continent as far as African science and research is concerned. And therefore, it brings in a number of units of maybe features, including maybe AI chatbots, institutional researcher profiles, research matching, profiling, an African research database with AI integration, and so many others. So far, it has quite a number of capacities. Over more than 100 years of data has been included and counting, almost like 6,000 author profiles, about 79 million citations, about 54 countries on the continent are all included. It's received a lot of traffic, and I just stop a bit to say it's still a minimum viable product, which means it's still under development, and the impact and interest that's already generating on the continent is quite substantial. Some of the impacts that come to mind: the ability to foster collaboration for groundbreaking research, rapid access to critical information for accelerated progress, catalyst for innovation and societal development. Again, all emphasizing the fact that when you strengthen research and development ecosystems on the continent, then you're able to achieve a lot of impact in terms of collaboration, identifying new partners, identifying new areas of inquiry, and so many other advantages and opportunities. Then the one other area that we're working on is policy prototyping, which actually means that we try to bring in African experts at the center of maybe policy making, where they jointly identify areas of need by policymakers and work with them to generate the relevant data. And then we also train them in terms of converting the research findings into policy that's easily absorbed and taken up by the policymaker. So we're hoping that at the end of the day, we're going to have a blueprint that will be able to help address this perennial problem of 17 years from average of 17 years from research to policy to less than four years. And I think we're already having some very interesting results coming out of the work that we are doing in Nigeria. To conclude, I just want to highlight the investment that the importance that it is very, very important to invest in research and development ecosystems. So that's very, very essential, as it drives innovation, it drives collaboration, and relevance in the global public health space. So without strong research environments, without strong research ecosystems, I think our work as far as trying to achieve impact and scale will be very, very difficult. Thank you very much, and over to you, Lucio.
Thanks so much, Alfonso, for this very insightful presentation. I think we are going to get a question which is directed to Catherine, and Catherine is going to give us the closing remarks. So maybe I just read the question. So this is the question. So Catherine, the question goes, what are the challenges and opportunities you see in integrating scaling science in the work that the African Population and Health Research Center does, considering the fact that it's a lead think tank within the evidence to policy landscape in the continent? Thank you.
That's a very difficult question, but I think definitely the presentation we've just heard from Robert was very eye-opening, and I have to say I've shared the link of the book on the WhatsApp, and there's lots of reaction. Some of the colleagues are here, and they said learning never stops. So we learned a lot even in these 15 minutes that you gave us. And so I think the opportunities are there. I think in terms of even we use words maybe loosely. We say impact, we say scale. I don't think the word impact, we've actually ever carefully unpacked what it means. So I see an opportunity to, go dive in a bit deeper, learn, and then see what does that mean for the kind of work that we do. Because I think maybe as is common, we have lots and lots and lots of innovations. And of course, there are lots of innovations on the continent. And almost every discussion you have about innovation, that's the problem. There's somebody who said that innovation is only innovation if it changes the status quo. We have lots of potential to change the status quo innovations, but not actually changing the status quo. And so in a way, this sort of reinforces that belief that you need to strive harder to change the status quo. And until we do that, maybe we can say we're aspiring. So I think that's a very general answer, but I think this has been really eye-opening in challenging us and try to see what do we do better. Because as you've heard, we are an institution that aspires to achieve impact. It's in our strategy, it's in our guiding principles, it's everywhere. And so we have to go and see what does that actually mean. Not just for individual researchers working on specific issues, but our strategy right now is focused on the wider ecosystem. So what does impact mean if your aspiration as an institution is to transform the ecosystem on the continent? I think that's really food for thought. So yeah, I think I'll stop there. I'm supposed to give closing remarks as well. Yes, we are over time. 1,000 apologies. Something happened and we just could not start the Zoom for some reason. So we're 20 minutes late, but we've managed to compress everything and finish maybe not 20 minutes after the top of the hour. I think I'll first thank the organizers, Lucio. I would imagine I see Alphonsus in the wings, and probably this has his hands on it as well. So for organizing this opportunity, and to thank our amazing presenters. I would say thought leaders in global health who have all made their mark in different areas and have generously shared their experiences. And you know, I think a good webinar is where you learn like 3 things, and I think I've learned something from all the presenters. And so I'd also thank the participants. The numbers have dropped at the top of the hour, but we had almost 170 participants at some point. So thanks for taking the time. And for the people who asked questions, very insightful questions. There's something which struck me. Julie McCann, I don't know that she's still online. She said, we're all trying to build the same house. And I think that will be something that I will try to see, like, what house are we trying to build and whose house are we building? I think many times as scientists, we assume we are building houses for people. Maybe we should ask them, whose house is it? And so that was really something that is a very good framing of where partnerships should lead us. And other than that, I think it has been an evening well spent and maybe a very early morning for Peter and Robert. I don't know where Magda is, but I hope it's been a very well spent morning, and let's keep the conversations going. Thank you very much.
Thank you so much, Catherine.
So much,
and
Catherine. This
thanks,
has been
everyone.
wonderful. Thank you for having me.
Okay. Thank
Thank
you.
you. Bye-bye.
Bye-bye.
Thanks so much.
Bye. Thank you.
Bye.